Welcome back, everybody. Ready for another deep dive?
Absolutely, let's do it.
Today, we're going deep on something that, honestly, I didn't know much about before. Parathyroid glands.
Oh, yeah, they're fascinating little things.
And, getting ready for this episode, going through this medical text you all sent in about the surgical anatomy of the parathyroid glands, it's been a real eye-opener. I had no idea how much was going on with these tiny glands.
Yeah, they don't always get the spotlight, but they are absolutely essential.
Okay, so let's start with the basics. Could you tell us where exactly are these parathyroid glands and what on earth do they do?
Well, picture this. You've got these 4 tiny glands,
Okay.
each about the size of a lentil,
A lentil, okay.
tucked away in your neck, usually right near your thyroid gland.
So they're neighbors?
Yep. And their job, they're like the body's calcium guardians.
Calcium guardians, what does that even mean?
They're responsible for keeping your calcium levels perfectly balanced.
And why is that so important?
Oh, it's more important than you might think. I mean, imagine a world where your nerves are constantly misfiring, your muscles are cramping all the time,
Uh,
and your bones, they become brittle and weak.
oh, that sounds awful.
That's what life without proper calcium balance would look like.
Okay, wow. Suddenly those little lentils seem a lot more important. But how do they actually control calcium? It's not like they have little hands reaching out and adjusting levels, right?
You got it. They do their work through a hormone they produce. It's called parathyroid hormone, or PTH for short.
Okay.
PTH is like a messenger that travels through your bloodstream, telling your bones, your kidneys, even your intestines how to handle calcium.
So it's PTH that's actually doing all the work.
Pretty much.
Yeah.
But PTH has a powerful partner in crime, vitamin D.
Oh, interesting.
PTH actually activates vitamin D, which then helps your intestines absorb calcium from your food.
Ah, so it's a tag team effort.
Exactly. Teamwork makes the dream work.
I like it.
Ah,
Okay, this is making a lot more sense now. But, you mentioned these glands are usually near the thyroid.
yeah.
And the excerpt you sent in, it's all about surgical anatomy.
Mm-hmm.
Makes you think maybe their location isn't always so straightforward.
That's right. Remember those lentils I mentioned? Their exact location, it can be surprisingly variable.
Really?
That's why surgeons sometimes compare finding them to a game of hide and seek, but obviously with much higher stakes.
Wait, hold on. A game of hide and seek inside the body. That sounds a little unnerving. Tell me more.
Think about it. You've got these tiny glands the size of lentils, and they could be anywhere. Snuggled up right next to the thyroid, hanging out near major blood vessels,
Okay.
even down by the heart.
Wait, near the heart. How do they end up so far away from the thyroid?
Believe it or not, it all goes back to how they develop. You see, the parathyroid glands and the thymus, which is part of your immune system, they actually arise from very similar structures way back during embryonic development.
Oh, interesting.
It's like they're distant cousins on the organ family tree.
Whoa, okay. So even though they end up in totally different parts of the body, they have this shared origin.
Exactly. And that shared origin, it comes from structures called branchial pouches.
Branchial pouches.
Yeah, imagine them like little pockets in the developing embryo's neck. The superior parathyroid glands, they come from the 4th pouch, so they stay relatively close to home. But the inferior glands, they come from the 3rd pouch,
Right.
which means they have to migrate further during development, leading to more potential locations.
Ah, so that's why their location can be so unpredictable. So the names superior and inferior, it's not about their location in the adult body. It's more about where they started their journey.
Exactly. It's like how, your hometown doesn't dictate where you end up living as an adult.
That's a great analogy.
Mm.
So for surgeons, this developmental history, that's got to be crucial, right?
Absolutely. It's like having a roadmap to guide them through the anatomical maze when they're looking for those glands.
That makes perfect sense. Knowing their potential paths of development would definitely give surgeons a better chance of finding them. Why would surgeons need to find them in the first place? What happens when things go wrong with the parathyroid glands?
Well, remember how we talked about that delicate calcium balance?
Yep.
When the parathyroid glands malfunction, that balance gets thrown completely out of whack.
Okay, so we've got this finely tuned system controlling calcium in the body. What happens when that malfunctions? I have a feeling it can't be good.
You're right about that. The most common problem is when the parathyroid glands start producing too much PTH.
Too much PTH.
It's called hyperparathyroidism.
Hyperparathyroidism, so too much PTH, which means...
Too much calcium in your blood. And that might sound harmless, but it can lead to a whole cascade of problems.
Like what?
from fatigue and weakness to kidney stones
Oh.
and even weakened bones.
Wait, I thought calcium was good for your bones.
It is in the right amounts, but too much of a good thing can actually be bad.
How so?
In hyperparathyroidism, the excess calcium, it leaches out of your bones,
Oh, no.
makes them brittle and prone to fractures. It's a real paradox.
Wow, that's a lot to take in. So we've got these tiny glands that can end up practically anywhere, and when they malfunction, it can lead to some pretty serious consequences. This is really making me realize how important those calcium guardians are.
They are, and to make things even more interesting, sometimes people have more than the usual 4 parathyroid glands.
Wait, more than 4? You're telling me there could be 5 or 6 of these things hiding in there?
Absolutely. These extra glands, they're called supernumerary glands, and they can be a real surprise for surgeons. Imagine meticulously searching for 4 glands and finding 5, or even 8.
8. That's crazy. I bet that makes surgery even trickier. Speaking of surgery, how do surgeons even approach these cases, knowing that these glands could be practically anywhere?
Well, it requires a deep understanding of embryology, careful surgical planning, and honestly, a bit of detective work.
Makes sense. But before we dive into the surgical side of things,
Yeah.
let's talk about the other end of the spectrum. What happens when there's not enough PTH? Okay, so we've talked about what happens when these parathyroid glands are overactive, but what about the other side of the coin? What happens when they're not producing enough PTH?
Yeah, that's a really important question. When PTH levels are too low, it's called hypoparathyroidism.
Hypoparathyroidism.
And just like hyperparathyroidism, it throws that calcium balance we talked about way off.
But this time in the opposite direction, I imagine.
Exactly. Instead of too much calcium in your blood, we're talking about too little.
And I'm guessing that causes a whole different set of problems.
You bet. Think muscle cramps, tingling in your hands and feet.
Oh.
And in severe cases, even seizures.
Oh, wow, that sounds really serious. So what causes hypoparathyroidism? What brings it on?
The most common cause is actually damage to the parathyroid glands during surgery,
Oh, I see.
especially thyroid surgery.
Makes sense given how close they are and how tiny those glands are.
Right. Remember how we talked about them being in unexpected places?
Yeah.
It's a really delicate procedure, and even the most skilled surgeons, sometimes they can accidentally damage the glands.
Or their blood supply, I imagine.
Exactly. It's like a double-edged sword. Surgery can be the solution for hyperparathyroidism, but it carries the risk of causing hypoparathyroidism.
So how do you manage that risk?
It really underscores the importance of finding surgeons who specialize in this area.
Okay.
Surgeons who understand the complexities of parathyroid anatomy, surgeons who know the ins and outs of this specific kind of surgery.
Right. So let's say someone develops hypoparathyroidism. What are the treatment options?
Well, the goal is always to restore that calcium balance we've been talking about,
Makes sense.
and that usually means calcium and vitamin D supplements
Okay.
to help boost those calcium levels back up.
I see. So you're essentially replacing what the body isn't producing enough of.
Exactly. It's
Yeah.
all about finding that sweet spot, that Goldilocks zone where the calcium levels are just right.
I like it. The Goldilocks zone for calcium. It's kind of amazing to me how these tiny lentil-sized glands, they can have such a huge impact on our overall health. We started this deep dive thinking about them as just these obscure little things in the neck, and now it's clear they're involved in everything. Bone strength, nerve function, the works.
It really does go to show you how interconnected our bodies are, and the more we learn about those connections, the better we can take care of ourselves, right?
Absolutely. Now, I've got to ask, when you're in there operating, looking for these tiny glands, are there any special tools or techniques that you use?
Oh, yeah, for sure. We have imaging techniques that can actually help us pinpoint the glands before surgery even starts.
Oh, wow.
So we can plan our approach really carefully
Oh, I see it.
and minimize the risk of, damaging anything important nearby. And then during the surgery itself, we've got these specialized instruments magnification tools,
Okay.
so we can really carefully dissect and identify those glands.
So it's not just like going in blind and hoping for the best.
Absolutely not. It's all about precision.
That makes sense.
Yeah.
But even with all of those advances, I imagine there are still cases where it can be really tricky to find those glands.
Oh, absolutely. Sometimes they're hidden behind other tissues, or they're smaller than usual.
I see.
In those cases, we rely on our knowledge of anatomy and embryology to guide us. Thinking back to that roadmap we talked about earlier,
It must be like trying to find a needle in a haystack.
it can be challenging, yeah. But that's also what makes it so rewarding when you are successful. It's like solving a puzzle. And knowing you helped your patient regain their health, That's what makes it all worthwhile.
Yeah. I can imagine the relief patients must feel when they've gone through the surgery and they finally have their calcium levels back in balance. It sounds like you're not just a surgeon, but also kind of a detective in a way, tracking down these tiny glands.
That's a great way to put it. You have to consider all the possibilities, use all the tools you have. Sometimes you even have to trust your gut.
And you mentioned earlier that sometimes people can have more than the usual 4 parathyroid glands.
Right.
What's the story with those extra glands? Are they always a problem?
Not always. Sometimes they function perfectly normally,
Okay.
don't cause any issues at all, but they can make things more complicated.
Especially during surgery, I imagine.
Exactly, especially during surgery. You go in expecting to find 4, and then suddenly there are 5 or 6.
I bet that throws a wrench in the plan.
Yeah.
So how do you handle those supernumerary glands during surgery? Do you just remove them all to be safe?
Not necessarily. If it's functioning normally and it's not causing any problems, we might just leave it alone.
Okay.
But if it's enlarged, overactive, then we'd likely remove it along with any other problematic glands.
So it's a judgment call based on the individual patient.
Exactly. You got to weigh the risks and benefits and make the best decision for each person.
And even after a successful surgery, some patients might need ongoing care, right?
That's right. Sometimes they need monitoring or treatment to make sure their calcium levels stay stable.
So it's not always a one and done kind of thing. It can be a long-term commitment.
It can be. But with the right care and attention, most patients can live totally healthy, fulfilling lives.
You know, through this whole deep dive, one thing I've been wondering about is WHY. Why is there so much variation in where these parathyroid glands end up? Is it totally random? Or is there some evolutionary reason for all this seeming chaos?
That's a great question, and to be honest, scientists are still trying to figure that out.
Oh, really?
There are a lot of theories. Some researchers think that the variability, it might be a leftover trait from our evolutionary history,
Like a holdover from when our ancestors had different anatomical structures.
Exactly. Others suggest it might actually offer some protection against injury or disease.
Oh, interesting. Like if one gland gets damaged, the others can pick up the slack.
Precisely. But whatever the reason, the variability definitely adds to the complexity when it comes to diagnosing and treating parathyroid disorders.
For sure. Well, this has been an incredibly fascinating deep dive. I feel like I've learned so much about these tiny but mighty glands, and I'm sure our listeners have too.
Me too.
Yeah.
It's always so fascinating to explore the human body and see all the incredible things happening under the surface.
Absolutely. Now, before we wrap up, anything else you'd like to share with our listeners about the parathyroid glands? Any final thoughts or insights?
You know, it's wild. There's still so much we don't know about these tiny glands.
Really?
Yeah, there's a ton of research going on, like the interplay between the parathyroid glands and other body systems. It's a whole frontier.
Like what are scientists still trying to figure out?
Well, one area that's really hot right now is the role of parathyroid glands in things like osteoporosis.
Osteoporosis. Hey.
Cardiovascular disease, too. There's some evidence that even small imbalances in your calcium levels can have long-term effects.
You mean on things like bone health and heart function? Wow, that's incredible. It really makes you think. These little glands might be involved in a lot more than we ever realized.
Exactly. The body's an incredibly complex system, and all the pieces are connected. Even the ones we think of as small or insignificant, like the parathyroid glands, they can have a big impact.
That's for sure. Well, you've definitely helped me understand just how important these glands are. I'm not going to lie, I started this deep dive knowing next to nothing about them. But now I see them as these key players in a much bigger story.
I love that. I'm all about sharing the wonders of the human body, and if I can spark a little curiosity in someone, that's a win.
Speaking curiosity, is there anything in particular about these glands that you're most excited about, like a specific question or area of research?
Good question. I think the potential for new non-surgical treatments for hyperparathyroidism is really exciting.
Interesting.
Right now, surgery is pretty much the go-to treatment.
Right.
And we've talked about the risks that come with that. So if we could figure out a way to manage it with just meds.
Or something less invasive?
Exactly. That would be a huge game changer for patients.
That would be incredible. It sounds like the future of parathyroid research is pretty bright.
Oh, for sure. It's moving fast. And it really highlights how medicine is constantly evolving, right?
Absolutely. Well, I want to give you a huge thanks for taking us on this deep dive into the world of parathyroid glands.
You're welcome. It was my pleasure.
Seriously, I've learned so much, and I bet our listeners have too.
I hope so. I think it's important for everyone to learn about their bodies and, maybe get inspired to learn even more.
Well said. And to all our listeners, we hope you've enjoyed this journey with us into the fascinating world of parathyroid glands. They may be small, but they are mighty, and they play a crucial role in keeping us healthy. And hey, who knows, maybe one of you listening will be the one to crack the code on those lingering mysteries surrounding these tiny but mighty glands.
That would be awesome.
On that note, it's time to wrap up this deep dive. Thanks for joining us, everyone, and we'll catch you next time. Keep those minds curious.